Gentleman from New York, Mr. Tonko.
Thank you, Mr. Chair. Thank you, witnesses. I'm pleased to hear some concern expressed on the other side of the aisle regarding access problems that people are having in interacting with the healthcare government, healthcare.gov website, and look forward to working with them in a bipartisan way to make that happen. I sense two great demands out there. One, a great demand for this product called the Affordable Care Act. Second, a great demand placed by the public into our laps to get this business of connecting access to the system done in a bipartisan professional way. I would also like to echo the comments of many of my colleagues in distinguishing between the unfortunate rollout of the website and the underlying promise of the law itself, that all individuals will finally have access to affordable health care. And many of the benefits of that package are now well known and very much appreciated. No longer denial by the industry because of pre-existing conditions. Students being able to stay on their parents' plan until the age of 26. Seniors not having to pay as much money out of pocket for prescription drugs and eventually closing that donut hole. And the list goes on and on. While there might be problems with the website, we have heard it here this morning and it's worth repeating. We have to fix it, not nix it. We have to fix it, not nix it. It's an important mantra that guide us forward. Mr. Chair, when people are able to overcome these initial bumps in the road, they're discovering a quality product that will save families hundreds of dollars a month on health care costs. You don't have to take my word for it. Fox News contributor Sally Kahn, upon discovering that her family will be saving $408 per month in my home state of New York, said, "Ideologues may not like Obamacare, but my wallet and my family's health sure do." So while we're here to address the real problems of an underperforming website, we can't ignore the larger story that affordable health care has finally become a reality for millions of Americans, and that is something we should not delay. Ms. Campbell, that being said, most of the bugs in the system we have heard about here today have been with the federally run website, healthcare.gov. Is that correct?
That's correct.
And how many states are currently participating in the federally facilitated marketplace through the healthcare.gov website?
36.
Now, it was my understanding that the Affordable Care Act envisioned that the states would be taking the lead on designing and running these exchanges. Do you have a sense of why 36 states chose to let the federal government take the lead instead?
I have no further information to support that.
But I think it's clear to state that this was how it was envisioned to work and would have been beneficial. From what I can tell, many states that refused to create a state-based exchange did so largely for ideological reasons. Now, did CGI Federal participate in building the exchange websites in any of the states running their own exchanges?
Yes, we have.
And my sense is that the states that have taken ownership of the Affordable Care Act and designed and run their own exchanges are outperforming the federal exchange. Would you agree with this assessment?
That is correct.
Thank you, Ms. Campbell. And I do agree that the picture that we have seen in the state-based exchanges is vastly improved over what we are seeing through healthcare.gov. My home state of New York, which also experienced website problems at the outset, has now signed up nearly 174,000 New Yorkers for quality, low-cost health insurance. That means that more New Yorkers have completed an application and received an eligibility determination than any other state in our nation. This is clear-cut evidence that the temporary setbacks can be overcome and success can be achieved when the law is implemented the way it was intended, without malice and obstruction. In closing, I would implore my Republican colleagues to reject the politics of division and join with us in finding constructive solutions to these technical problems so that the many millions of Americans demanding and deserving access to the private sector-driven healthcare options they now have before them is a reality. With that, Mr. Chair, I will yield back.